Oh, we're done, huh? I didn't know you'd given your spiel. Okay, well, the subject tonight is kidneys, and which I've sort of decided from a lot of reading is perhaps our most underappreciated organ. We just sort of assume they're going to do great things for us, and you're going to find that probably about half of everybody we know is in the very initial stages of kidney failure. However, there's so much reserve, it doesn't much matter as long as it doesn't progress. So I'm going to turn you all into nephrologists. Now, that's an ologist of the nephron, and the nephron is a little microscopic unit in the kidneys, which we will see that each kidney has about 1 million of them, and so they do microscopic filtration and all add up to be functional kidneys. So let's, okay. Now, a lot of us don't have excellent kidney function anymore, but it isn't necessary because there's so much reserve. But that leads to some questions about where are our kidneys on the scale of good to bad, and how can we tell that, and what are likely problems, and what causes those, and what can we do about them, and how do they work in the first place. And more grimly, what got me into this was, having done this for the last 4 years, all the doctors here giving a series of talks during the year, I was trying to figure out, after 3 years of giving them, what I was going to do this year, and I came to the conclusion that I would do something that sounded kind of grim and talk about the things that are most likely to get us. Well, I've done that through the year, and now we're down to kidneys, which is the 8th most likely thing to get us. And it's pretty low down the scale, because the first 2 account for 55% of things that might get us. And so it doesn't sound like a very big figure, and it's not unless you've got it. So let's see, what do I do? Okay, now let's just talk about some housekeeping questions. Waste products from cells enter the bloodstream. The liver does a lot of cleansing and drains into the gut for exit from there. The liver also prepares materials to exit via the kidney. And with kidney filtration, large protein molecules aren't lost, they're kept. And neither are the small ones. It's the middle-sized ones that are the waste products, so the kidneys have to be rather sophisticated as to how to get rid of the middle-sized ones without getting rid of the big ones or the little ones. So here's some basics, and you know some of this. They're sort of in the back of the abdomen. Each one is about 4 to 5 inches long, about fist size. And the blood filtration passes through the kidneys several times a day, not instantly, because the kidneys aren't filtering all the blood that's going that way. It filters some of it. It's like an air cleaner in a room. It doesn't suddenly clean all the air in the room. It just keeps cleaning a little bit at a time. So with the filtration, the urine is created. It collects in the kidney pelvis. You'll see what that is. It's a funnel-shaped structure. It drains down the tubes called ureters and into the bladder. And each kidney, as I said, contains about 1 million units called nephrons. And as much as 90% of kidney function can be lost without experiencing any symptoms or problems. But by the time you get that far down, you're in pretty much trouble. Let's see. Okay, now, this is just for general circulation. You're looking in the body, and the red lines are the arteries, and the blue ones are the veins returning the blood from the body back and into the general circulation to get oxygenated in the lungs and pumped out by the heart. And you see the kidneys are located right about down here, and you get the idea that this great big red line is the aorta, the biggest one coming down from the heart, and there are branches off of that to all the organs, and we can see the little branch of the renal artery going into the kidney there. And for some reason they just show the renal vein returning it over here, but each one has an artery and each one has a vein. Okay, thank you. I'll try to be careful. What do I point at? Oh, okay, I got it. Now, another view is just showing you where everything inside, lungs, the diaphragm is underneath it, the liver is sitting there, and we'll see that the liver is more right on top of the right kidney, and it's going to turn out to be lower just because it's pushed down by the liver, and there are the intestines, and here are the ureters coming down to the bladder. Now, a close-up. So we see the diaphragm muscle, and there's a little split in it where the aorta comes down, and here it branches off the renal artery going into the kidney, and you see the return of the blood into the circulation there. And in the kidney, you see that the urine would gather into the pelvis and go on, the renal pelvis, and go on down in the ureter. Up on top, you see something here that's not very clear. It's more clear over here. The kidneys are called the renals, and so this is added to it, so they're called the adrenals, and you know about those. And they're always described as having a roughly pyramid shape, but it wouldn't go over in Egypt very well. And of course, there's the characteristic, well, we said that the right one is a little lower than the left one because the liver is above it up there. The characteristic shape, of course, is what the bean was named for and not the other way around. Now, if we're looking at this again and we're saying, well, okay, so the blood is going out here and some action is taking place that causes filtration, and let's take a look at what that actually is. Now, this looks like a complete mess. I'll sort it out for you, and then we'll shift to a diagram that is much simpler, but this is actually how it might look under the microscope if you could get down real fine and look at it. So here's the blood coming in from the renal artery, and it goes down to a smaller artery called an arteriole, and it comes up here and it goes into something rather special called the glomerulus. That's what actually does the filtration. And we see built around this is some kind of little capsule, and science seems to be crazy about heroes and names things after people who found them first, so it's called Bowmans capsule, and I guess he found it somehow. Not that it wasn't there already. Now, we see that the blood goes on from this filtration on out through here and eventually becomes venules and then larger and back into the veins. Well, meanwhile, the filtration from this is going out through here very complicatedly, and finally the flow from this can get dumped in, along with a lot of other units like this, into a channel going down to the renal pelvis. Now, as I said, that's kind of complicated looking, but the reason for showing you that thing is we're going to show you some very specific things about this part right here. It turns out that this is a much simpler diagram. We see the glomerulus right there. And so the filtration of small and medium-sized molecules takes place, saving the larger molecules like proteins into the blood. And so now you've got to get those small ones back in. We'll see how that's done. But it happens, the filtration occurs here. The small ones and the large ones look like they're being filtered out here. But actually what's going to happen is the small ones get back in and the medium-sized ones, did I say that right? The medium-sized ones and the small ones get filtered out. The small ones like sodium ions, chloride ions, and so on get back in, and waste products are going to end up going out. And so this whole thing is a nephron, and that's the glomerulus that does the little first trick, and there's another nephron. Now, this is just a diagram of Bowman's capsule to show you a fine little batch of capillaries there, which together with the capsule performs this very talented thing 2 million times for you. Now, this diagram is showing you the fact that you can secrete into this channel leaving all these things that you might want to get rid of. You can recover water. You can recover sodium, potassium, chloride ions, and stuff like that. You can recover up here some more. So actually, this whole nephron is doing this whole very specialized batch of things, amazingly, to keep us going, keep us cleansed, not urinate away all our sodium, which would make us feel very terrible. And this is even a simpler schematic diagram, just showing the glomerulus and the Bowmans capsule, and shifting from the artery through the veins and secreting into urine elimination and recovery back in. Okay, as of this point, you're now all nephrologists, okay? Ologists of the nephron, a kidney doctor. Now, let's talk about some things that can trouble us. And one simple one is kidney stones. And it's not really exactly a kidney problem, but it happens there. Because, see, if you have something in the urine that's so concentrated it doesn't stay dissolved, it tends to precipitate out. Well, it's slow enough that it actually precipitates out, sometimes as crystals, sometimes as just little lumps. And they can be made of various things, like calcium oxalate is pretty insoluble stuff. So if some calcium meets some oxalate, it's going to precipitate probably. But if there's a lot of uric acid, that can do it too. Small ones pass down the ureter fairly unnoticed, so we're probably making a few of these all the time. And so long as they're small, we don't even know about them. They're just silent, and they happen and they go away. Some may be large enough to actually block urine flow, either in the kidney itself or in the ureter. They're also rather sharp. They're crystals. And they might produce kidney pain if they're in the kidney, and they might even cause some damage to tissue and therefore cause bleeding. So as we said, these tiny ones are silent, but if it's too big to pass easily, this causes what's called flank pain, meaning over here, and it can feel like a large rock trying to pass through a small tube. It is considered one of the most painful conditions. You can ask anybody about that who's had one. Fortunately, the tube stretches, and it usually passes in a few days, usually seeming about 3 years to the person who's got it. But there are various things that can be done to help relax the ureters and so on like that. So you start forming a stone up in here, and if everything goes okay, it goes in and flops into the renal pelvis and then goes on down unless it gets stuck, and then you begin to feel pain. If a stone doesn't move through, it can be helped to pass. If it doesn't pass from the kidney and causes trouble, one non-surgical procedure known as lithotripsy, the litho is a term called stone, and basically they put the person down in a very high-class tank of water and aim ultrasound shock waves at it, and they blow it apart into little pieces that then pass. And that technique hasn't been around for very many years, so there used to be a lot more kidney operations than there are now because they can just blow them to pieces and they go away. There is something that is very intriguing to me. There was a research publication in 2008 about a non-surgical procedure that is not in general use, and sadly there are no other reports of investigating this other than the one paper in 2008. And I just thought I'd share this one with you because if somebody turns up with a kidney stone, I may try this. Now, gallium is a mineral, and it happens to be a potent antibiotic for what are called nanobacteria. They're very, very small compared to regular bacteria, but one of the things they do is cause calcifications. For instance, most of the calcifications you've ever heard of that have happened in people's heart arteries or something like that are due to nanobacteria putting a calcified coating around themselves. So there was the report of a woman who had kidney stones and pain and blood in the urine, and some enterprising physician made up a weak solution for her of gallium nitrate and had her drink this for 3 days. And all of a sudden, she was urinating white urine. Powdered calcium stones were being released the pain ceased and the bleeding ceased. However, she got the stones again 1 year later, and the treatment was repeated, so it wasn't an accident. However, as I say, there's no other investigation of this, just this one thing 7 years ago, which I find awfully curious. Now, there are people that are referred to as stone formers simply because they seem to have the talent for doing it more than once. And if it does happen to somebody, we all ought to start investigating what is this stone made of, because that's going to make a lot of difference what kind of chemistry that we try to change in the person and what chemistry involved. And was it simply that they weren't drinking enough water? Because that, of course, would concentrate the blood and make it more likely. So if somebody gets a kidney stone, it's supposed to be a warning that they're supposed to be more generous with their fluid intake than they were before. There is another report that for people who were classified as stone formers, meaning they did it more than once, extra B6 and magnesium seem to greatly reduce the likelihood of stones. And I think that's true. Now, let's shift to actually things that go wrong in the kidney. That is, when we talk about kidney failure, we're talking about failure to filter it very well. And some medical writers have claimed it to be a rather silent epidemic involving 17% of the population, which is a fair-sized amount. Now, you saw that they're marvelously intricate, but the more intricate something is, the more ways of interrupting the function. So it's good that we've got 90% spare, but as I said, if you're down to 10%, you can't afford to lose any more. And the problem can be a bit like driving a car with a broken gas gauge. You don't know anything is happening until the car sputters. So we don't want to be about that, and we'll talk about how we know how we can detect this tendency early. It's very simple. It's most normal blood work would include it, but now you're going to be educated about how to look at your own blood work and see how your kids are doing. So the topics I want to cover are symptoms of kidney failure and early lab detection and the stages of chronic kidney disease. We're talking about getting worse and the kidneys not performing very well and progressively, because it does tend to be a sort of progressive condition. Now, it's possible that somebody can have reduced function that is very stable due to whatever, and they're not in any particular danger. But when you see somebody here the year before last and here last year and here this year, you know there's a process that's ongoing, and you better do something to stop it, or it's going to be worse than that the year after next. So we'll talk about an assortment of kidney problems and approaches to kidney failure and some causes and some treatments. So it has such huge reserve that there aren't any symptoms for a long time. And so at a low level of failure, nothing's noted. However, the kidneys perform so many different functions and so many body systems can be affected that the symptoms can vary. Now see, we know that it eliminates waste. What we may not do is it actually controls fluid balance in the body, because you saw in those diagrams of the kidneys, water was being absorbed and so on like that. And then electrolyte balance, we're talking about those little ions, sodium, magnesium, sodium, potassium, chloride, and stuff like that. So the balance of those is controlled too. So any of these things that went wrong, that was not being done well, you would get a different set of symptoms from each one of these, see? So it's not the easiest thing in the world to listen to somebody and say, you have a kidney problem. And then there's some other things that the normal citizen doesn't necessarily know about. It says signaling for bone marrow for red cell production. Oh, you see, if you need to remind the bone marrow every once in a while, hey guys, maybe it would be good if you made a few more red cells. It turns out that the signaling device for that is placed in the kidney. Well, that's a good idea, because you've got the blood going through there and the state of oxygenation can be detected. And if the state of oxygenation is kind of low, the signal goes out from the kidney into the blood that ends up circulating back to the bone marrow that more or less says, hey, more red cells, please. And then there's this one. Maybe you know, a lot of people I run into don't understand that the control of blood pressure is really in the hands of the kidney. There are materials that can be released from there that will tighten up the muscles in the blood vessel walls, and that's to tone them so that they're not floppy and you don't pass out every time you stand up. But on the other hand, remember that everything in the body is going through the kidney, and if you put things through there that are highly disagreeable, maybe it's going to muck up the kidney somehow, and that may affect the blood pressure mechanism, and all of a sudden the blood pressure mechanism is out of hand, and we wonder, gee, easy peasy, I was just doing fine, and all of a sudden I've got hypertension. So, kind of surprising, most persons with severe kidney problems do not have any decrease in urine output, even in advanced kidney disease. So, symptoms, they aren't very specific. They can be frequent urination, especially at night, but gee whiz, there's a lot of things that can do that. There can be leg swelling and puffiness around the eyes. Now, we're not talking just about the bags under, but it's puffiness around. So we're talking fluid retention. High blood pressure, we should think about the kidney. There can be other things. Fatigue, well, geez, that's the major reason people go to physicians. But this says from anemia, so we're going, oh, if the signal doesn't go out from the kidney to the bone marrow, there are not enough red cells. They're not carrying oxygen from the lungs around to cells in the body that don't have lungs of their own. The body may feel kind of breathless when it's sitting still, much less exerting itself and running out of air, and fatigue is one of the symptoms of that. And itching. Yeah, if people don't have good functioning kidney, sometimes stuff comes out through the skin and it itches. And easy bruising, it's, for some reason there is, and I don't really understand it fully, there is a connection between people having low vitamin K and not clotting easily and bruising easily. Shortness of breath, if they get fluid accumulation in the lungs, again controlled by the kidney. Headaches, a whole lot of stuff. But as I said, this is non-specific. They can be due to complete other things. Now, it turns out this one's worth mentioning. Your vitamin K, whether it's the kind you get from sunlight on your skin or the kind you get from the health food store, that's the start. And then that goes over to the liver, and it chemically operates on it a little bit, and then it goes down to the kidney, and it chemically operates on it a little more, and all of a sudden you have the active form of vitamin D. So that means if you have severe kidney problems, maybe you're not activating your vitamin D very well, and you think about everything that does, allow you to absorb calcium, and it has a big effect on bones and a whole lot of other stuff. It has an effect on muscles even. So vitamin D is the effect of it is very pervasive, and if one has a severe kidney problem, maybe there's a problem with activating vitamin D. Let's talk about laboratory detection. And as I said, this information is in routine lab health screens. And one of the numbers is referred to as BUN. The molecule is called urea, and I've always wondered why in the world they had to say this, because they used to just say urea. Maybe they think that's impolite or something. The molecule was named that for where it was found. It's a very small molecule, so that means it's easily filtered out by the kidney. It turns out it's a waste product of partial use of amino acids. And when somebody realized, oh, this is a molecule that's easy to test for in blood, and it's filtered out very well by the kidney, so if it goes high in the blood, it might mean the kidney's not working very well. So that's really why it's there. Now, a little more sophisticated is testing for this material, which is a waste product of muscle action, and it's a slightly larger molecule, so that would be considered, if that one was elevated, that would be considered a little more serious, a little more than if urea was elevated. And then we come down to this one. We're back to the glomerulus, the thing that's really doing the first filtration. Now, the E stands for estimated because it depends on the creatine number and your age and a bunch of other numbers, and it's a calculated number, but it's pretty helpful. And so this kind of tells you how it's working. Now, excellent is about 100. For some reason, a lot of labs don't give you an actual number. The lab I use, I had to go fight with them and said, I don't want you to tell me whether it's above or below 60. I need to know whether it's 80 or 61. So they supply me with a number because 80 is fine and 61 is scary. Again, 59 does not mean somebody's going out from kidney problems, but I need to know where they are. So now, another one is the protein is not supposed to be filtered out. So in a urinalysis, if there is protein in the urine, again, this is one of these things that everybody has a right to have a little protein in the urine once in a while, but if it's a big deal, if there's a lot of it, and if it's persistent, that's telling you there's a kidney problem. So you're now an expert on your own lab work and how your kidneys are doing. So see, not too many people are up here above 90. Above 90 is considered excellent. Just everything is peachy keen. And frankly, probably 80 is too, but that's the beginning of a lowering that one would be interested in. Were you going to be 80 the rest of your life, or were you going to be 70 next year? Now, this is a table that shows the so-called stages of chronic kidney disease. And so they're saying, well, stage 1 is above 90, and they shouldn't have really done it that way. They talk about 5 stages. There should be normal kidneys in 4 stages, but they do it this way, and I have no idea why. But see, this says normal kidney function. Okay, now, however, 89 down to 60, they're saying mildly reduced. Now, I'll tell you, most of the population is in here. And we can say, well, gee, why would most of the population be in here? Is this human destiny? No, I think it's modern life and various exposures we get is why most of us are in there. Now, if we get below 60, things get a little more exciting. Far less people are down here because they're talking about moderately reduced. Now, moderately reduced doesn't mean moderately, it means moderately reduced. And then it goes down lower than that, and down in here somebody has to be on dialysis, so they're going to be really toxic. Now, so just sort of a rehash in words. Stage 3, you'd want careful management and consultation at least every 6 months to prove that it's not getting any worse, because stage 3 is definitely lower than stage 2. Stage 4 is severely reduced. Stage 5 is very severely reduced, and probably on dialysis down here. Now, I'll show you a problem that's not the fault of the kidney. Can we nudge this? Thanks. It turns out that some heart problems can cause kidney problems, and some kidney problems can cause heart problems. So, chicken and egg. I want to tell you about one of them. Now, it's referred to as prerenal kidney failure, so it is kidney failure, but the fault is before the kidney. So remember back to where we had the aorta from the heart pumping the blood coming down and then sending the blood to the kidney. Suppose the heart doesn't pump very well. Okay, so if it fails to pump well, as in what's termed congestive heart failure. Now see, when somebody first hears congestive heart failure, they go, good grief, am I going to die right now? It really means failure to pump evenly. So you've got 4 chambers, and what's happening is the bottom right ventricle is pumping harder into the lungs than the top right atrium is pumping down into the left ventricle, so the lungs get wet. In other words, you're pushing fluid out through the blood vessels in the lungs, and it's kind of hard to breathe through water, you've noticed probably. And that's what congestive heart failure means. It also means that you're probably pushing fluid out into other places, and you may have swollen legs and so on like that. But at any rate, what I'm trying to get to is that if this is not pumping from the heart very well, you're not pumping to the kidneys very well, you're not cleansing the blood very well, and so usual kidney failure symptoms can occur. The waste products may affect the brain. I'm going to tell you a story about that. Other kidney functions may be done poorly. It's called prerenal, as the causes before the kidney. Okay, the small story is this. A few years ago, I got a telephone call from doctors in a hospital in Asheville, North Carolina, that said my mother was there and they thought she was dying and that I might want to know, so I got up and ran to Asheville. Now, I got there, and it turns out that she had sort of what they thought was terminal kidney failure, and I said, you do understand, don't you, she has a long record of congestive heart failure? And they said, no, we didn't do that. She travels a lot. Meanwhile, I go in and see my mom. Now, see, she's toxic from not enough kidney function, and it has affected her brain, temporarily at least. And she was totally convinced in talking to me that we were of the family of Timothy McVeigh and the government was after us. Now, he was the Oklahoma bomber, remember? And so I'm going, yeah, Mom, I gotta watch out for those agents. Yeah, Mom. And so at this point, see, there I am in Asheville, North Carolina, which is the biggest town in western North Carolina, but it is in New York City. So I go to the telephone book at the nurse's desk, and I look for the few health food stores in there, and I find one that's about 10 blocks away, and I walk there. And what I'm looking for is coenzyme Q10, which is known to jazz up the mitochondrial energy generation in especially heart, and a few hundred milligrams of that will pull people out of congestive heart failure. So the only size they had was something ridiculously small. I don't remember what it was, 20 milligrams or something like that. So I bought them out, you know, about a dozen bottles of it. And I go back and I start feeding these to my mom. And by morning, I walk in and she looks at me and says, I was really far out, wasn't I? And I said, yes, but I got to go talk to the doctors. So I go out and talk to them and said, this is what's going on. And this is what I did. And they said, and I said, will you keep this going if I have to leave? And they said, well, is it in the hospital dispensary? And I said, no, it isn't a prescription. And they could not guarantee me they would keep it going. And we, you know, I did come back. She was okay for a while and so on like that. But it was one of these very hairy things. And I was dealing with some doctors that weren't very nutritionally educated. That is a polite term from what I'd really like to say. But anyway, that's the small story, which is a really great example of prerenal failure. Hopefully, if you meet anybody, they won't be Timothy McVeigh. Now, recent related research, though, there's a report in 2015 titled Restoration of Thyroid Hormone Balance, a Game Changer in the Treatment of Heart Failure. Wow. This is quotation. The idea that thyroid dysfunction contributes to diseases leading to heart failure has been discussed for over 50 years. Discussed. Evidence from animal and human studies suggests that thyroid hormone treatment may improve clinical outcomes. And then also it says, if a similar positive information was available for a newly developed heart drug, there is little doubt that a large-scale clinical trial would be underway with considerable excitement. I thought that was very revealing. You've seen stuff like that before, like, where are we It's not that pharmaceutical companies haven't made a great contribution in a way, but sometimes we just get too darn dependent on them and avoid the obvious, that thyroid hormone controls the speed of every single process in your body. It's basically like your life flame. It's turned down. Everybody with low thyroid hormone is colder and tireder and slower. And you turn it up and everything runs a little better. Here's another one from 2015. Evaluation of thyroid hormone levels in chronic kidney disease patients. Okay, that's right on. A significant decrease in the levels of thyroid hormones in chronic kidney disease patients. Now, exactly, that's sort of saying if the doc is examining somebody with chronic kidney disease and they happen to have a temperature well below 98.6, somebody needs to order a real thyroid profile, not just TSH, which is only going to find 24% of the ones that are low. Okay, another paper, chronic kidney disease and hypothalamic pituitary axis dysfunction. Well, they're talking about the hypothalamus talking to the pituitary, which talks to the thyroid, and so they're saying, well, chicken or egg, whichever choice you like. So, a quotation out of here. Recent evidence points toward hormonal disorders in the genesis of chronic kidney disease, starting it off. 2013, 2 years ago, I will practically guarantee that you won't find one doctor in 1,000 who knows this. It is amazing to me. But you're going to see in here in a minute. I was a little weird when I was writing one of these slides. There are somewhere between 2,000 and 4,000 medical papers a day added to the National Library of Medicine. Nobody is up to date. You can't be. If you had nothing else to do, you couldn't read 2,000 in a day and know what you'd read. So, more thyroid. Association of renal failure with thyroid dysfunction. Well, so one moral is check their thyroid function. Oh, yeah, this is where I got weird. Another is that every physician should have a split personality, one to read papers and one to practice. Okay, additional kidney conditions of note. There is something called pyelonephritis. Now, that's where you actually have an infection in the kidney pelvis. It's bacterial usually. It causes back pain and fever. Back pain without fever is probably not pyelonephritis. It's probably a strained back. But you can get fever from all kinds of things. So I don't want you to think every friend of yours with a hurt back has a kidney problem. It usually rises up from a fairly innocent bladder infection, but that doesn't happen very often at all, thank goodness. We have a pretty good immune system, and the flow downward keeps it from going backward. Then, glomerulonephritis. Okay, so we're talking about the glomerulus, and nephritis, the nephron, inflammation of the nephron, particularly in the glomerulus. Okay, this is an immune system problem. It's an autoimmune problem attacking for some strange reason, and it can result in a degree of kidney failure. There is something called nephrotic syndrome, where damage to the kidneys causes them to spill large amounts of protein into the urine. That can be detected very easily. What happens? One of the things that keeps your fluid mostly into the blood circulation and not out into your tissue where you would go sloshing around is the protein in the blood sucking the fluid in to be less concentrated. See, so down here, if you're losing the protein out of the blood, you're going to get tissue swelling, and gravity being what it is, it happens in the legs first, and you see that. But yes, that can happen for other reasons too. So again, leg swelling is not just kidney. It can be thyroid. It can be it can be heart problems. Polycystic kidney disease. Now, this is one of these things that can be genetically inherited, but there are a lot of things that can be done about that these days. Papillary necrosis. So this is talking about the papilla of the kidney. Again, this is a weird thing that fortunately doesn't happen much. Diabetic nephropathy. Okay. An unknown diabetic has got very high blood sugar. That's being tried to be filtered through the kidney. It can damage it. So not only do they have high blood sugar, but they can damage all kinds of things, nerves in the eyes, kidneys, and so on like that. So it's a good idea a few times in your life to get your blood sugar checked. Kidney cancer, well, that's obviously a pretty bad one. But this may be something that you don't know, that smoking is the most common cause of this. See, we think about smoking as possibly giving us lung cancer, or if you smoke and you don't get lung cancer, you're destined to get emphysema probably. But if you think about the fact that all the stuff that comes in when you smoke gets into the body circulation and has to exit. So it gives people who smoke a higher rate of colon cancer, a higher rate of bladder cancer, a higher rate of kidney cancer, all the exit ports, see. Interstitial nephritis. Now when you see the term interstitial, you're talking about in the tissue, and automatically that's an autoimmune disease. So connective tissue, that's the stuff that connects everything else together. It doesn't function like liver cells or kidney cells, it just glues everything together. So an inflammation of connective tissue, that's a classic type of autoimmune problem. It can be manifest anywhere, and there's a lot of things to do about that. And autoimmunity can be triggered by all kinds of things. Chemicals like drugs, other chemicals that are supposedly not even helpful, and so on. There's something rather strange called minimal change disease, meaning they've got a kidney problem, but when you look at it under the microscope, it looks pretty ordinary, so not much change. So, strange name. Nephogenic diabetes insipidus. Now, this term is not talking about blood sugar diabetes. It's talking about extremely, extremely dilute urine and a lot of it. And there is this diabetic insipidus that can occur when your pituitary gland goofs up, because one of the things that is supposed to make is something called ADH, that stands for antidiuretic hormone, which means that you don't diurese and get rid of all your fluid, you keep it. So that's the common one, but there can be one that's due to a kidney problem. Renal cyst, well, those are hollowed out spaces in the kidney, and they're, I wouldn't say normal, but very usual and not particularly threatening in any way. So, definitions of this. There is what's called acute kidney failure. It is often reversible, but severe and sudden, and it's most commonly happening to people in very chronic condition in hospitals and stuff like that. And so it has a lot of severe symptoms associated with it. What it goes on most of the time that I'm most concerned with is what we call chronic kidney failure. Chronic meaning it's continuing slowly, it's not leaving. In this case, it is less reversible. Some people think not reversible. I think it is at least partially reversible if you find out the cause of it. It's also referred to as chronic renal failure or chronic renal insufficiency. In case you see those terms, they're all the same. It can seem sudden in the sense that somebody says, wow, you've got this and you didn't have it last year or something like this, but it comes on very gradually over years. At some point, the remaining nephrons will not filter blood enough to stay healthy, and the big point is to recognize it and recognize the causes and stop the causes, or the kidney function will continue to decline, because whatever the cause is that's got you down this far is still going unless you stop it. I think this is pretty poorly addressed in general medicine because they don't tend to look for cause. They tend to just monitor the person and say, yeah, you're a little worse than last year, but don't worry, meaning we'll tell you when it's time for dialysis. You need to do something about it. But then that may come from my education previously as a chemist. You want to do something about things. So chronic kidney failure, we're talking about low GFR or progressively lowering glomerular filtration rate. Look at the forces that can act on it? Well, high blood sugar, hypertension, too much pressure on those little blood vessels in the glomerulus, allergic reaction. All that stuff has to be filtered through there. What is an allergic reaction? It's a situation where the immune system has been temporarily prompted to be somewhat violent. But see, most allergic reactions, when you no longer have the exposure, they go away in a few days. Gluten intolerance is an autoimmune condition of monumental nature and can additionally attack you absolutely anywhere between the head and the toes. And there's a 1975 paper that I wish more physicians knew about, where they found out that people with celiac disease have antibodies against their connective tissue, and if they stop eating gluten, they don't have the antibodies, and if they eat it again, they have the antibodies. So it means essentially that if you've got celiac disease and eating gluten, you are slowly taking yourself apart. Fortunately, we have a few repair mechanisms, so we don't seem to fall apart too quickly. Drug reactions. Well, there are some drugs that seem to be relatively safe and others that are not quite so safe, and some that set off some people and not others. And since everything is filtered through the kidney, sometimes they're bad news for some people in the kidney. Autoimmunity. Well, considering that it can hit you anywhere, why not the kidney? And now we get down to the environment. This is talking, toxic organic is talking about non-metal materials that are man-made that we have tossed out there, herbicides, pesticides, solvents, and so on like that. They're made of carbon, and they usually have a few other kinds of atoms with them, hydrogen, maybe nitrogen, some oxygen, and whatnot. They're largish molecules. They tend to be fat-soluble, and they store themselves in our fat. And we carry them around for a long time. Now, metals are relatively smaller, and we have thrown away lead, cadmium, mercury, arsenic, antimony, da-da-da-da-da-da. And they're all out there and coming back to us in the air and the food and the water. And I'll jump ahead and say this. Strangely enough, to me it's strange, the American Medical Association only admits to 2 conditions that can be caused by toxic metals, in spite of thousands of research papers. Maybe next year they'll admit to a 3rd. But those 2 happen to be kidney problems and high blood pressure, particularly of cadmium, because that is a very, very toxic material. But lead and mercury are pretty close behind, and so is all the rest of them. See, antimony is a toxic metal. Did any of you happen to remember that they used to fireproof children's pajamas with antimony? That's a real cool idea, isn't it? The dumps are now all full of ex-pajamas and leaching into the soil and so on like that. So, and then of course, if somebody already has a known autoimmune condition, whether it's relatively innocent sounding like rheumatoid arthritis or some of the worst ones, that essentially means that your immune system has already gone a little bit insane over some particular part of the body, and you don't know when it might do that to some other part of the body. So you have to watch people who have known autoimmune diagnoses. Now, causes. Okay, the number 1 cause in the U.S. is claimed to be high blood sugar of undetected diabetes, and the second is uncontrolled high blood pressure, and the accumulated toxic metals and other chemistry can't be far behind because that affects more persons than diabetes. And I told you about that already. And there can be family genetic influences in kidney failure, and there can be autoimmune attack. And we mentioned this already, that the high blood pressure can damage the tiny vessels in the glomerulus, and then in reverse, abnormalities in the kidney can cause hypertension, so it can sort of go either way. Suggested approaches, assuming that kidney failure has been identified by lab testing. Well, we want to pursue causes because it's just going to get worse. So we try to locate every influence on the kidneys. Like, of course, we'd worry about how the glucose is and how the blood pressure is and what prescription drugs and whether or not there's any family tendency, and whether or not there are immune aspects like food allergy or autoimmunity, and checking toxic metals and other chemicals. So we saw earlier that undetected hypothyroidism frequently accompanies chronic kidney disease, so that should definitely be checked. And there are many, many papers on this. I just threw one of them in here in 2012. It says, we currently recognize that environmental toxins, lead, cadmium, and arsenic, the only ones they covered in that particular paper, play a significant role in the development of chronic renal failure. Now, see, I didn't say this before. Why does the American Medical Association only admit to 2 problems? Because there is so much evidence for those 2 that if they didn't admit to those, nobody would ever believe them again. So the metals cause what we'd call oxidative damage. They actually promote the formation of oxygen-free radicals, which are very tissue damaging. And there's a lot of evidence that drinking green tea reduces oxidative damage. There are many other things that will do it. But I thought I would acquaint you with this, simply because having heard over the years the goodness of green tea, I started trying to drink it many years ago. So I must have tried out 50 brands from various grocery stores. It all tasted green to me. So I had a postdoc a couple of years back. She was Japanese. And when we were on our weekends working together, she had her own tea, and it turned out to be this. And I said, where did you get this? And she told me, and I said, how did you know about it? She said, my grandmother told me to buy it from Costco. So there's some educated grandmothers. So if you want to try that, I consider that kind very drinkable. It's good quality Japanese green tea, and the Japanese are very particular about their green tea. So this is pretty good stuff. I'm sorry?
You don't have to be concerned about radiation or whatever, radiation particles or whatever it is.
No, see, the tea doesn't get irradiated and glow and do you anything. No, I don't think you have to worry about that at all. Now, we lack a lot of answers about some of the exact mechanisms of reduced kidney function, and we've already shown you that there's a bit of chicken and egg stuff that isn't sorted out completely yet. But we know the accumulation of toxic metals from the environment, that we all have some, and some of us have a lot more than others. And I'm glad I'm not in the position of being in the government, but if I was, I would lobby to have every 14-year-old check for toxic metals and not wait until they're 45 years old to find out their levels are high. See, when children are growing, they actually accumulate them faster than we do. So it would be a good idea to identify them early. And years ago, they did some studies like examined the children and the adults in family that lived near the freeways, making allowance for how many hours they were home and everything else, and they found out the children accumulated them much, much faster than the adults did. So, again, autoimmune attack. Your immune system is your personal version of Rambo the Protector. It's an 800-pound gorilla on your side. You hope that the 800-pound gorilla does not forget who its friends are, because otherwise you're locked in the room with an 800-pound gorilla. And that's not a comfortable thing if it doesn't know who you are. So the summary here is, the first goal in chronic renal failure is stop the progressive decrease. Now that can take time to see the measurement change, but when it's successful, there can even be a rise in the glomerular filtration rate, indicating that we're winning the game to some degree and at least stabilizing the situation, if not being better off. So, as explained, the damage is believed largely to be permanent, but stopping the progression will mean a healthier life and no future of dialysis. So, okay, I'll be glad to show my ignorance if you have any questions.